Hi, I'm Dr. DiLorenzo at Danbury Chiropractic and Wellness, and today I'm going to demonstrate how we utilize one of the most well-researched chiropractic adjusting techniques called Cox flexion distraction adjusting. Now, this technique is utilized for many conditions. Those commonly that we treat in our office are disc herniations, those that have disc protrusions, bulges in the cervical spine, as well as a condition called spinal stenosis, which is a narrowing of the opening around those exiting nerve roots or the spinal cord itself. Now, you have to have a specific table in order to apply this technique, as well as we have our certification in this office as well. Now, this table is very intricate, especially when it comes to this cervical headpiece. It's very intricate in its motions. So you see, we can apply various ranges of motion, such as traction. You can see the table moving out nice and smoothly, and the traction force can be applied to the cervical spine. It can also move in flexion. So you can apply flexion in each one of these vertebrae individually, as well as lateral bending of the cervical spine. So I can restore all 6 planes of motion back to each one of these vertebrae individually in order to restore function back to the spine. Now, let's, as an example, say this patient has a C5-6 disc herniation with associated arm pain, numbness, tingling, or burning type pain all the way to the hand. This is how we would apply this adjustment. One, I would unlock this table in flexion, contact the associated segment that I want to decompress. So utilize my hand contact here. And as you can see, this table is going to drop down nice and easy into flexion. So it's not a large motion, but we can achieve several things with this type of adjustment. One, we can decrease that pressure inside the disc. So with a disc herniation, you're going to see excessive pressure built up inside that disc, causing it to compress the nerve root. So with this adjustment, we're allowed to decrease that pressure, allowing it to recede off the nerve. As well as, in cases of spinal stenosis, you have a narrowing of the area around the nerve roots, those exiting nerve roots. So this increases that area. So we're able to achieve that all with this nice, gentle, smooth, rhythmic motion with this adjustment. Patients that have arm pain, while adjusting, a lot of times they report that their arm pain dissipates with treatment, while being treated, as well as following treatment. Also, those patients that do not like their neck adjusted in traditional fashion and achieve that popping sound in their cervical spine, although research states it's extremely safe, for whatever reason, those who don't like that sound, this is a great, effective alternative to adjusting these patients. So that's how we apply Cox flexion distraction adjusting in treating a C5-6 disc herniation in the cervical spine. For more information on the various conditions we treat in our office or about this Cox flexion distraction decompression adjusting, you visit our website at DanburyChiropractic.com.